Every day begins quietly, breath enters the lungs, blood flows, the brain commands without any effort. Most people don't think about stroke, not until the silence is broken. A stroke doesn't arrive with warning bells, it doesn't knock, it waits. Hidden behind busy schedules, behind unspoken stress. Behind numbers on a health check that were never looked at. This is the story of how life-changing damage can begin long before the moment it strikes. High blood pressure is the greatest silent driver of stroke, day after day. That constant pressure pushes against artery walls, stretching them, weakening them. Until they can no longer hold, there's no pain, no sound, only damage accumulating quietly. Over time, arteries harden and narrow. Blood struggles to pass through. In the brain, this means one thing: risk. A vessel may clog, or it might suddenly burst. Either way, oxygen stops flowing. Brain cells begin to die. Every single second matters. Stress feeds this fire. Uncontrolled stress raises blood pressure. It tightens your blood vessels. It completely exhausts the heart. Sleep shortens, hormones surge, the body remains in a constant state of alert. A body that never rests is a body moving closer to collapse. And our lifestyle choices, they quietly shape the outcome. Excess salt, processed foods, smoking. Too much alcohol. Too little movement. None of these cause a stroke overnight, they prepare the ground for it. Stroke is often the final chapter of a long, ignored story. Years of pressure. Years of stress. Years of saying, "I feel fine," until suddenly everything changes. A face droops. Speech breaks. An arm won't rise. Time fractures. This is a stroke. In that moment, the brain begins to lose millions of cells every minute. Treatment is a race, not against fate, but against time. There are two main forms of stroke: ischemic stroke, caused by blocked blood flow, which is the most common, and hemorrhagic stroke, caused by bleeding in the brain, often sudden, severe, and deadly. Both steal function, both steal independence. Survival is not the end of the story. Many survivors face paralysis, loss of speech, memory damage, even personality changes. Families become caregivers, homes become rehabilitation centers. Life slows down, but it never returns to what it was, and yet, a stroke is not inevitable. Up to 80% of strokes are preventable. Control your blood pressure, manage your stress, eat wisely, move your body, avoid tobacco, limit alcohol. These are simple actions, but they have powerful outcomes. Medication, when prescribed by a doctor, isn't a defeat, it is your defense. It is a choice to protect the brain before the damage becomes permanent. A stroke is silent until it strikes, but that silence can be broken. Check your blood pressure, respect your stress, choose health, because the strongest shield against stroke isn't luck. It's awareness, taken in time. Thank you for watching, and please, take care of yourself.